trying to solve. This is Maria del Mar Logroño Narbona, Senior Advisor at ARDD on Inclusive Social Protection and Access to Justice, and a founding member of the ISSPF network. In today's webinar, we will be addressing the right to social protection in MENA for persons with disabilities, and we will be looking at challenges, opportunities, along with some reflection on steps to activate an agenda for social inclusion. In order to address these issues, we have a distinguished panel today with us. We have Farah Hashami, Senior Fellow of the Arab Reform Initiative, Hala Darwish, Social Policy Officer at UNICEF Syria, Luca Pellerano, Senior Social Protection Specialist with ILO, and Rachel Forrester-Jones, Professor and Director of the School of Health Studies at Western University. We will first, just to let you know, a couple of notes on the flow of the session today. We will first give the floor to interventions from civil society, Arab Reform International and ARDD, myself, and then we will move to our colleagues from UNICEF and ILO, and then we will ask Professor Forrester-Jones to provide some insights regarding global experiences and wrap up the panel by summarizing and commenting some of the issues that have been raised in the panel. And then we will try to be quick. We will try to leave plenty of space for question and answer. So we will be taking about 8 minutes each of us. And then again, leaving plenty of space for Q&A. In terms of logistics, I want to let you know that there is Arabic translation, and we have also sign language interpretation available. If you explore the channels, you will see the availability. One of the technical challenges, when we have been informed how to proceed, is that while you will see some of the PowerPoint presentations, you may not see panelist faces because we will have to switch off the video to allow for sign language interpretation to be able to show. So I think we are ready to start. Well, I would actually like to acknowledge that one particular disclaimer. Well, in the panel, we have no organizations with persons with disabilities represented. Some of our panelists are members of disability groups, and we do hope that there may be some organizations with us on the call that are organizations of persons with disabilities. In any case, this is a first step towards what we hope will be a more structured regional dialogue and international dialogue. And also I note that although the meeting will take place in English today, which we know it's not the language of MENA countries, we expect that, again, this dialogue in future opportunities will take place in Arabic or other language of the region. So without further ado, let me introduce our first speaker today, Farah Hashami from Arab Reform International. She's a development economist, and she's currently a senior fellow at the Arab Reform Initiative, leading ARI's social protection program. She has 8 years of experience working with CSOs, academic institutes, and UN entities on advancing policy reforms in the Arab region. I welcome Farah. So please, the floor is yours. Thank you.
Thank you very much, Maria, for the kind introduction. It's a pleasure to be among you today, and thank you to Development Pathways, ARDD, and the ISSPF for the kind invitation. So basically, this topic is of primary importance, needless to say. One of the most vulnerable social groups in Lebanon and in the Arab region, and one of the most susceptible to shocks and crises are people with disabilities, all kinds of disabilities. In Lebanon and in the Arab region, being contexts of recurrent crises and shocks and conflicts, armed conflicts particularly, this makes us like a fertile space for having more people with physical disabilities, and especially with mental disabilities, or what our colleague Rachel calls intellectual disabilities. People with disabilities are excluded from public spaces in Lebanon and in the Arab region, from quality education, from economic activity and the livelihood opportunities that they must have because of loose labor codes and because of poor law enforcement whenever the labor code has got this element of protection for them. They're also often excluded from social life, and more importantly, or most importantly, from the healthcare that they want. I mean, to highlight, the how prone this social group is to shocks and to crises, I'd like to highlight the fact that in addition to the fact that there are people with disabilities and they have this like dealing with this impasse during their day-to-day life, they also intersect with other forms of vulnerability, and we all know that. And this, I mean, not only they intersect with other forms of disability, but they are susceptible to other forms of vulnerability. And there is a correlation between other forms of vulnerability and between having a disability. For example, I can give here the example of refugees coming from war zones. So many examples can lend proof to this, and coming from the urban poor, from informal settlements, catching diseases whereby, for example, there is no awareness on polio. So there is a high level of correlation between having any different other forms of vulnerability and having a disability. And this is also to say that people with disability are not a homogeneous group, as we all know. Although because we are in Lebanon and in the Arab region, like way behind, like addressing their needs, we often deal with them as if they're like just one block, one social group. But mental disabilities are various and are at different levels of being acute. Psychological disabilities, likewise, physical disabilities particularly are at very different levels of severity. Each one has its own specificities and its own needs. And there is also this high correlation between physical disabilities and mental disabilities or mental impairments that we should be also aware of. Now, I mean, I'm gonna to start digging deeper into the Lebanese context more specifically, I'm going to begin by mentioning what the Member of Parliament, Dr. Inaya Azzuddin, mentioned of equality organized by UNESCO earlier in June, earlier this month. She was saying that we need to legislate the right to health and to legislate the right to social protection. Now, I don't know how a member of parliament who also belongs blocks and the country is saying that. I mean, what are you doing as a member of parliament if you are saying that? And I mean, I do not also see the fact that the right to health and the right to social protection is indeed at the core of rights of people with disabilities for those to be protected. But the thing is that it's not the legislative component that needs to be put to the fore. It is rather the law enforcement and the political will to act what is legislated and what is part of the constitution. So there is no political will indeed. Instead, we see that social inclusion is being used, like this example that I just gave, as a buzzword, as a box checking, and is not like like the politicians and the international community sometimes are not dealing with this as like the reality. They're not capturing the reality in their discourse and are not acting on it and exerting enough effort to actually advance a real, true socially inclusive development agenda. I'm gonna speak about the political economy behind that later, but I mean, because I have been trying to give a snapshot of how vulnerable people with disabilities are, I'd like to mention that the most critical forms of disabilities are forms that are very subtle, that we do not see, whether physical or mental or psychological. For example, people with schizophrenia. And this is accompanied or coupled by the lack of awareness about the importance of mental and psychological health, for example, and how important this is for people's well-being and for people's prosperity. In Lebanon, for example,
جهودا لتأمين خدمات لهؤلاء الأشخاص. في لبنان مثلا الحماية الاجتماعية
if at all, if existent, when it existed, it has mostly taken the form of social assistance, of poverty targeting programs. The National Social Security Fund, if we are to speak about the pre-crisis era, the branch that is related to people with disabilities has always been dormant since the very establishment of the National Social Security Fund, and so was the unemployment branch, and so was the social pension branch. These are dormant branches or departments, if we are to call them, of the National Social Security Fund. Even the branches that were active before the crisis, actually, like employment-based insurance, they do not take the specific needs and the extra needs of the people with disabilities into account. Private insurances, even if you are not to speak about public contributory or non-contributory health insurance through the fund, through the state-led social security system, if you are to speak about private insurance, private insurances also do not cover. Private insurances do not cover chronic diseases, do not cover cardiovascular diseases. They do not cover. They didn't cover COVID-19 at the time of the pandemic either, and so they do not also cover people with schizophrenia who need psychiatric attention, who need some medical attention or some hospitalization because of their schizophrenic episode. So when I mentioned the employment-based social protection that the National Social Security Fund was providing before the crisis, it was providing that through labor unions. And we know, I can give an example of a schizophrenic person belonging to the engineering, the syndicate of engineers, who has schizophrenia and who could not actually access the medical care that he needs as a schizophrenic person, even though he benefits from the insurance through the syndicate that he belongs to. And I mean, the reason why even the tools and the delivery mechanisms that provide social assistance or some kind of social security to the general population, not speaking about people with disabilities, even those that do not provide, even those that exist, do not provide this protection to people with disabilities specifically. This is because of so many factors. One of them is stigma. And is also the lack of awareness and the lack of education on the part of the subjects that we are talking about, on the part of the people who are concerned. They are not encouraged to disclose their case early on. They are not mobilized and encouraged to also voice out their grievances, to actually ask for that to become a right, and to be aware of whether the insurance, be it public or private, covers their case from the onset when they subscribe or they buy this insurance. And this is because indeed of stigma, because people with disabilities, physical and mental, are dealt with, many kinds of disabilities are dealt with as a taboo, and because we think that vulnerable groups do not need to be educated about, their rights, or because these are their needs and they know what are their needs. But no, they do need to be educated about the concepts, and they do need to be educated about these elements being their rights and not being something that they are asking for, and that is a luxury or is a privilege for them to have. It is their fundamental right to have this. Now, when the crisis came in 2019, even the National Social Security Fund, and even, the very mediocre kinds of social protection that people with disabilities in Lebanon used to benefit from, got frozen. And we know that for long, the compensation wasn't reflecting the real dollar value of the Lebanese lira, whereas all medical equipment that people with disabilities need, and the medical treatments that they often also need at hospitals, at medical centers, are also charged at the real dollar value of the Lebanese lira. So this made things even worse, although we were in the middle of a crisis, economic overlapping with the pandemic, overlapping with the Beirut blast, and with so many other problems, which made people with disabilities be in a situation that is even more impairing to their functioning and to their operation, and as human beings and as economic agents in society. We do have the Lebanese Public Law 2020-2000 that entitles persons with disabilities for comprehensive livelihood services, for social service, speaking about social protection here, education, health, employment, housing, leisure. But again, this is not implemented, that we have poor law enforcement. And this goes back to the political economy, which I'm gonna, of the issue, which I'm gonna talk about later.
Sorry to interrupt. If you could wrap up Thank you. Believe it or not, it's already 10 minutes.
Okay, this is too bad, because like it's just now that I'm starting to actually talk about so I'm gonna wrap up. So basically, up to 2/3 of households with a member of disability are living in the lowest income quintile, compared to fewer than 3% of those in the two richest quintiles. Before the crisis, over 2/3 of people with disabilities in the country, in Lebanon, lived in households that did not receive any social assistance, which shows the level of disparity they are subject to, and especially the barriers they face. This is why they are seen as family burden. They refer to families, to associations, to this like informal networks as support systems. And for those that do not have the support system, we find them on the street, and they cause threat to themselves or to the society. And this is how we make them a burden, because we make them a lost resource and a wasted human capital that we don't benefit from. Now, to protect people with disabilities, they can only be protected, like really protected, via a social protection floor. They cannot be protected via social assistance that does not provide social security. The social protection floor should entail a universal health coverage, knowing that in addition to the typical universal health coverage, they need extra health care, as we all know, and they do need those like universal grants for universal, when it comes to people with disabilities, I mean, as a population, that cover the core life cycle for them and their life contingency having a disability. Not the allowance, not the, for example, the National Disability Allowance Program that was launched, funded or supported by the EU through ILO and UNICEF, and in collaboration with the Ministry of Social Affairs. I mean, this was a big step. This was an important step, and we were very happy to see this, because amid the current situation, and given that there is no political will to actually reform the national social security system in general in Lebanon, we are happy that at least there is this kind of assistance that is taking place. It's meant to cover over to 20,000 Lebanese youth aged between 18 and 28, who will benefit from regular cash transfers of $40 for a period of 12 months, starting in April of this year. So the good side is that indeed this is better than nothing, if we can say that. But we are still talking about poverty alleviation, about social assistance, which excludes so many people. Even in the population that should be targeted, so many people will be left behind, because the targeting method is proxy means testing, which excludes people by definition. So it's not universal, it is not effective, and not adequate for sure. I mean, what is a cash transfer of $40? I mean, if we are in a country that is in a situation of galloping inflation, of a 3-digit inflation. So I'm sure everybody agrees that this is not adequate, and this is definitely not sustainable. This is very transient. And
Farah, if you can wrap up now, that would be great. Thank you.
Okay, I don't know. I'm trying to be selective of the thoughts. Maybe I can carry on later. But just to wrap up the idea of cash transfers here, just because I was speaking about that, and I keep the additional information for later for the Q&A. So basically, this has been the way people with disabilities have been supported in Lebanon through poverty targeting. The poverty targeting is very transient, and poverty targeting programs are not integrated. They're very disintegrated. I mean, ESSN 1, now ESSN 2, the NPTP, now the National Disability Allowance. I mean, there will be some double dipping. There will be people who will benefit from different programs, and there will be people that won't benefit from any program. We do not have a universal social registry, a unified registry that would allow the targeting method to become a bit more effective and more more effective, basically. And this is not sustainable. It's relying on foreign aid. It's transient. At some point, we will not be able to. We are wasting development money that was supposed to go on development to build a social protection infrastructure, something that is a little bit more viable, more long-sighted. We're wasting it on humanitarian aid that is basically inadequate. So I'm gonna stop here, and I can speak more about about that and about other dimensions to the topic at a later stage.
Thank you very much, Farah. Thank you. Thank you for such a comprehensive view. And yes, indeed, I think this is just a first webinar. And as we can all, let me just put my video on. Thank you again. I think as we can all see, we are dealing with a topic that has a magnitude beyond of what we can even start to imagine. So now I will be the one presenting. Let me just share my screen. Let me see if I can share my PowerPoint. Here we go. So once again, I'm María del Mar Logroño Narbona, and I am the senior, sorry, it's too much technology and having to handle my own presentation. I'm the senior advisor to ARDD. I've been with the Arab Renaissance for Democracy and Development. It's an independent NGO in Jordan, and I've been working with them since 2014. I've been leading some access to justice and now inclusive social protection research and programmatic work. So today, what I will share with you is a presentation that actually most of the information is already available in a report that you can see for ISSPF. And let me just, I think, excellent, here we go. And it's available on the ISSPF website, and it's looking at the right to social protection for persons with disabilities entitled Beyond Ink. Because as Farah, you were saying, in Jordan, we have a very similar, I think, a very similar situation of what you are mentioning with several differences. But one of the strongest aspects that Jordan has is a very strong legislative and governance framework. But there is the implementation that really makes a difference. And this is where the bottleneck, we also see one of the major bottlenecks. So let me just give you some of the key social indicators of Jordan for those of you who do not know Jordan. Jordanians living under the poverty line were estimated at 15.7%. Recent estimates, not officially released, but have been talked about, put it at 24%. Refugee population under the poverty line is estimated to be at 78%. The national disability prevalence is 11.2%, whereas this rises to 30% among refugees. Unemployment rate among active population is 25% and rising, and reaching 48% among youth. And we have an employment rate of persons with disabilities of 16%. 82.2% are not economically active. There's also a very well-known factor that women's labor participation in Jordan is extremely low. And we have two key figures here. Health insurance coverage stands at 78% in the most optimistic estimates, and health insurance coverage among persons with disabilities is at 66%. Now, similar to what Farah was mentioning for Lebanon, if we look at a life cycle coverage and what are the three dimensions that are considered to be critical in terms of providing a dignified life: income security, coverage of disability-related cost, healthcare interlinkage. This is a table that more or less tries to synthesize what is available today in Jordan. So if we go into income security dimension, and we see in childhood, there's no family assistance benefits in Jordan. There are, however, we see monthly programs and aid, but there's no such thing as a disability for family members, for families. Working age, we do have disability pension for those insured through the Social Security Corporation or the equivalent, meaning other social security systems for different professions. And because here the key is, again, Jordanian citizenship sometimes, and the type, most important, the type of work, it's a determinant. So the area, social security, it's very fragmented according to the profession. And there are monthly assistance programs, National Aid Fund, Zakat, UNRWA provides as well for Palestine refugees. For old age pensions include from the Social Security Corporation 12% disbursement when there is a family member with disability, but again, it's a very low percentage of the population that benefits. And then there are monthly assistance programs in the form of non-contributing. Coverage of disability-related cost. For childhood, at the earliest stages, we see that the Ministry of Social Development, there's an early identification program rolled out with UNICEF, but we don't see these in other areas at other times throughout the life cycle. Healthcare interlinking. Universal healthcare coverage for children under 6 years old is available, but this again is under 6 years old, which leaves the whole of the population to basically fend for themselves. What we see is that there's a myriad of rehabilitation and assistive technology services by many providers, civil society and government, but they are fragmented, they are limited in scope, and the fragmentation means that families have to really do a search for what's available and what's not available. So this is in a nutshell a little bit of the view. Challenges, data collection. In Jordan, as in other countries in MENA, there's a very fragmented data collection, slow implementation of the international standards, the Washington Group. Social protection focuses largely on the incapacity to work. That's the definition of, when we are talking about social security law, it relates to incapacity to work. We have also very limited scope of, as we have seen, of social protection schemes available. There is another major challenge, which, as Farah was mentioning, relates to the types of disabilities. There is a discrimination of intellectual and learning disabilities, and this is something that we have explored in a forthcoming paper that will be launched in the coming week. And this is something that will require, we need to have a serious conversation on what are the limitations and what are the special actual needs to make, to level this big gap. And yeah, as I mentioned, benefits and services vary according to legal status, nationality in Jordan. And let's just remind that everyone that Jordan has 10% of the population is estimated to be refugee, have a refugee status or asylum seeker status. Opportunities. Well, you know, we also have to be optimistic of what has been achieved. Constitutional rights, CRPD ratified in 2006, and very recently we have the Rights of Persons with Disabilities Law number 20 of 2017, and we also have several policies that are linked to the work as of the legislation related to rights of persons, the law on for rights of persons with disabilities, which I think was a very important, and it is a very important step forward in ensuring the right to social protection. Although it's still, a lot of it is still in the ink of it. NUR, the National Unified Registry, there was a webinar, a very interesting webinar not so long ago, and this is a really interesting digitalization for better integration of services type of process. What's the problem here? And if I could see the Higher Council for Persons with Disabilities, which is the umbrella organization representing the right of persons with disabilities in Jordan since 2007, unfortunately, their NUR works as an aggregate of different databases. So Ministry of Social Development, Ministry of Labor, etc., you name it. I did not see in that presentation highlighted the Higher Council for the database from the Higher Council for Persons with Disabilities. And furthermore, this database is voluntary. People are voluntarily registered into this database. So it's not an exhaustive collection of persons with disabilities in Jordan. But when we look at also one of the strengths, we can see another of the important attempts to integrate, to work towards social inclusion, which is extremely critical, inclusion through work and through education. So the Vocational Training Corporation has offers various free training programs for people with different types of disability to help them qualify for jobs. And this is an interesting experience that I think we should all consider and see how it can be scalable and so on and so forth. Let me go to, I've already mentioned a little bit some of the challenges, but let me insist on the fragmentation. And why is this important? Because we look at what are the steps. We said, let's look at what are the steps to activate an inclusion agenda. One of the major challenges we have is from a service provision. is the coordination among different organizations that are effectively providing social services. We have around 154 organizations throughout Jordan that are critical in the provision of services. What the state doesn't do, these civil society organizations are really providing. That network of support is provided through these organizations. So while we are advocating for income security, disability cost, and healthcare, this social protection floor that Farah was mentioning, we should at least, I think there's a homework to do from civil society point of view to improve our referral system among ourselves. And we should be very attentive and monitoring and actively monitoring what are service delivery, quality in service delivery, and living standards of persons with disabilities and their families. This is something that we as civil society could be doing and we should be doing. We also should have a conversation in Jordan between closing the gap between the humanitarian architecture and the national framework. There are effectively two architectures. This is what we argued in our paper, again, on Jordan Beyond Income paper, where they are parallel structures. The response to the Syrian refugee crisis has launched a myriad of support, because as I mentioned, refugee population, and as we know, refugee population is severely affected by disability. We also need to enhance social multi-stakeholder dialogue at national level. This is critical. I don't think there are not enough conversations. And a final step is what we hope is the beginning, is this webinar. It's a regional dialogue for advocacy. So I think this is the end of my presentation. I will leave it here, and I am going to ask our next speaker, Ms. Hala Darwish from UNICEF, to step in. Thank you very much. Hala, I'm going to, let me just, okay.
Hello, everyone.
Yes, Hala, let me just give a few words of introduction since. So Ms. Hala Darwish has over 15 years of hands-on experience responding to the humanitarian crisis in Syria within the UNICEF system. Since 2016, she has been responsible for the implementation of the Integrated Social Protection Program for Children with Disabilities, the cash transfer and case management in Syria. Hala, the floor is yours. Thank you very much.
Thank you very much, colleagues, and thank you for this really informative webinar about the situation in MENA, in Jordan and Lebanon. It was really interesting. I just have a question. Can I share my screen for the presentation I have?
Yes, yes, you can. If you go to one of the menus and you say share screen, it should
Sorry, another at the same time. Yes. Can you see on my screen?
Yes.
And I don't know if my video is on, but anyway, it's okay.
Yes, your video is on and everything is fine. I think we can see both. Yes. Thank you, Hala.
Okay. So thank you for giving me the opportunity to speak about the social protection program in Syria Country Office. As earlier mentioned, I'm the focal point for the implementation of the disability program in Syria, which started as late as 2016, where we were already 5 years into the conflict, the Syrian conflict. So the Integrated Social Protection Program is a great example of how we can, of the implementation of humanitarian cash transfer in such complex situation, security situation, adding to it the recent economic situation where it is the worst ever that happened in Syria, adding to it the recent earthquake. So you can imagine the complexity of the context we are implementing this programming. I'll go into details. I know I can share further statistics about the economic situation, but I want to use the time to go into the details of the implementation of the program and the evidence generated from this program, so you can all learn about it. So the Integrated Social Protection Program for Children with Disabilities So it is an integrated approach to address the needs of children with disabilities, the families of children with disabilities. The objective is to improve the socio-economic well-being and the inclusion of children with disabilities. It's worth noting that it is built on the already existing social protection program that was designed by the government prior to the crisis. However, it was interrupted. So UNICEF built on the existing program, and we introduced this model. So it is integrated response. So it is cash assistance combined with referral and case management services for a duration of 24 months. The targeted group are children with severe and severe mental and physical disabilities. So those criteria were selected or based on the national classification, Syrian national classification for children with disabilities. And those are considered the most severe ones that requires full-time care. So as I mentioned earlier, we started 2016. It was a pilot program in Aleppo governorate. And then we expanded into now 6 governorates. The program has now reached over 55,000 children with disabilities in 7 governorates, sorry, not 6. It is considered the largest humanitarian social protection program for children with disabilities, and it is a unique model in the Middle East. Just to give you a hint of the medical disability profile of children enrolled in 2020, this is not updated yet, but it is it follows similar pattern where we see that the high percentage of disability type is the cerebral palsy. So we have 26% of the children are having cerebral palsy, which is also the main criteria used by the government for the disability grant before the crisis. Of course, you have 24 for quadriplegia and 20 and monoplegia, and 23% for profound and severe intellectual disabilities. We have 2 components for the program. We have the cash assistance, which is directly managed by UNICEF through contracting financial service providers. It is regular and conditional cash of $40 per month, and it is paid over the counter. The second component is the referral and case management. So it is following the localization agenda. It is implemented through partnership with national NGOs specialized in children with disabilities. So the NGOs are responsible for the identification, registration, and verification, including the referral and case management, monitoring, and evaluation of the program. So each case manager physically accompany the child and the family. They refer the child and the family to essential services such as health, nutrition, education, and wash, etc. And they provide specific case management services or child protection case management to children identified with child protection concerns. So this is also part of the synergies we have with our child protection colleagues at UNICEF. We have also the grievance and redress mechanism, which was introduced and developed 2021. So we have established a service phone line directly managed by UNICEF. And following each payment list, families are expected to receive SMSs to check about their feedback about the cash received, and then about the case management services provided by the case managers. As already mentioned, this program we have invested a lot in the evidence about and the results about this program. This helped us to improve the program, to have the lesson learned, and redesign the program based on it. I'm going to share with you a few evidence generated from the post-distribution monitoring surveys conducted during 2022 in 4 governorates in Syria, where the program was implemented. So as mentioned, so we have baseline and endline survey. We have standardized methods and tools. We have the sampling indicators questionnaires. It is the window for us to understand the socioeconomic situation of children beyond UNICEF programs. So we use this opportunity, the results of the PDM, to better understand the socioeconomic situation of children, not only children with disability, however, the families also residing in this in the area where the program is implemented. So we do not report only what it works. We report also areas to be improved. So I'll go. This is, I can share the link of the program for those distribution monitoring surveys. Just to, I cannot see. I'm sorry. I have to do something here. I cannot. I want to see the header, but it's not visible for me. Okay. I don't know if you can help me. I want to get rid of this. Oh, now I can. Okay. So for the okay. First information is about the major income source for the families. So as you can see from the statistics in the governorates where the PDM were conducted, we have 45% of the major income for the families is the salaries in rural Damascus, 59 in Hama, 27 in Hasake, and 48 in Aleppo. We have notable percent of families depending on the daily wages, like in Aleppo, 45%. I'm going to skip this information. Maybe you can, I can share with you the link if I can skip now. You cannot. I have issues. Sorry. Can you hear me?
Yes, Hala, I think maybe Mohammed can help you.
No, I
Here we
can't.
go. Here we
Okay.
go.
I don't want to go into the details. Maybe I can share
Thank
the
you.
presentation.
That
I
would be
just
great.
want to, yes, just to want to share major information, like for the education status of the children with disabilities benefiting from the program, where you can see that almost 71% of children with disabilities are without education. For example, in Hasake Governorate, 68 are in Aleppo, 49 in Hama, and 65 in rural Damascus. This is mainly related to the disability type of the children with disabilities we are targeting. This is also related to the a lack of specialized services, especially after the crisis, which is preventing children with disabilities of accessing school. So this is the we have the expenditure of the children with disabilities have increased before and after. We have the percentages how it increased before and after receiving the cash assistance. So this is about the impact of the receiving the cash assistance. And also share of expenditure. This is really important. Major share of the expenditure was also spent on food. This is due to the current economic situation we are having, like 35% in Hasake. Also, the largest share of the expenditure was spent on health, like 35% in Hasake, 26% in Hama, and this is also related to the medical targeted disabilities. We have high level of satisfaction of beneficiaries with the proximity, frequency, and amount of cash, and this is mainly the results of the PDM. Critical consideration, I'll move forward. As we say, we don't know the universe because we don't know how many children with disabilities in Syria who meet the 12 disability criteria, because we are not able to do formal needs assessment. We have our figures based on the estimates because of the security situation and the capacity of the partner. We have the value exchange rate. We have two exchange rate, the UN exchange rate and the formal and the black market exchange rate. So we don't have the same exchange rate in both programs. We have high level of inflation. We have the limited capacity of the financial service provider to absorb the caseload we are targeting. And also we have sectoral approach that the local capacity, as I mentioned, I think this is
Hi,
not
Hala,
much
sorry
relevant.
to interrupt. If you can wrap up, that would be great. Sorry we are very limited with time. Sorry.
Okay, I'll just wrap up that it's the key message we want to share here, that it is not, it's really not easy to implement a humanitarian cash transfer targeting such a vulnerable group in Syria within the humanitarian context. It was not easy, but it's not impossible. This is one key message. Just also to confirm that we have huge challenges with regard to the exit strategy, to the sustainability of this program, to the funding situation, and to the universality, and to being able to have this program targeting all children with disabilities and further through life cycle. And also transitioning this program into to the government due to the capacity and the funding situation, the fiscal issues. Over from my side, I hope I get the information needed.
Thank you very much, Hala, for really a wonderful presentation and what looks indeed like a really, really interesting program. And I like very much what you said, not easy, but not impossible either. So I think that's something we should stick to. Thank you very much, really. And I think, it's a great, it looks like a really interesting program, and I think one of the best practices. And now, thank you. I'm going to go over to, I'm going to give the floor to Luca Pellerano. He's a senior social protection specialist for the International Labour Organization in the Arab States region. He has provided technical assistance on the design, implementation, and evaluation of contributory and non-contributory social protection systems and programs in the Arab region, Sub-Saharan Africa, Eastern Europe, and Central Asia. Luca, the floor is yours. Thank you.
Thank you very much. My video has been blocked, so I hope anybody can unblock it, please. In the meantime, I will share my presentation. And thank you for the invitation and for the good discussion so far. I will share a few perspectives on the topic from a slightly more, if you want, regional perspective, regional dimension. I hope you can see my screen. Let me just find the right. Where am I?
We see your screen.
Okay,
Here
I
we
think
go.
you should see my screen now.
Yes,
great.
We
So
can.
I'm going to share just some thoughts from a slightly more regional perspective. As you've mentioned, I'm a regional specialist for the ILO, so I can I see this from the perspective of the MENA region, but I will also very much try and reflect on some of the specific country developments which are interesting. You know, many things have been mentioned. People with disabilities are at greater risk of poverty, social inclusion, deprivation throughout the life cycle, and social protection has a critical role to play in ensuring their well-being as well as to support their inclusion in society. So in that sense, as part of a social protection floors agenda, which the ILO very much champions and supports with partners in the region. Many have mentioned the key components of an effective multi-layer social protection system for persons with disabilities, which should include cash benefits that ensure a minimum level of income security in the context of barriers to paid work that are provided by a mix of disability specific as well as mainstream disability inclusion in social protection schemes. but also a blend of cash benefits as well as care and support services that can address and compensate for the disability-related extra costs across the life cycle, perhaps a topic we didn't discuss much until now, really to recognize the role of social protection to compensate the extra cost that persons living with disabilities face in exercising their full social and economic rights. And finally, universal health care coverage, as well as linkages between social protection scheme and the provision of other relevant services and early child development, economic empowerment. Now, when we look at, so this is the ambition, the region is far from delivering on this ambition of access and exercising the universal right of social security to persons with disabilities. This is a picture from the last World Social Protection Report telling us that only 40% of people in MENA access any form of social protection. And it's interestingly to see its coverage specifically for persons with disabilities. So as you see on the chart on the left-hand side, you see persons with disabilities overall in the world are only 1 in 3, 33% receive some form of social protection. Here we're focusing on income support, be it from contributory or non-contributory means. That percentage falls down to 17% in the MENA region. So the region is kind of falling behind what is already a relatively consistent coverage gap globally. And if you compare that with coverage, you see really how there is a very different capacity of countries in the world to deliver inclusive social protection systems by the level of incomes, with low income countries and low middle income countries really falling quite far behind, but high income countries are able to achieve relatively significant levels of coverage up to 80%. Now, what drives this low coverage in the region, and what are some of the systemic issues? Here we see on the chart the coverage of persons with disability. Again, the proportion of persons living with disabilities, severe disability in this case, I need to put that disclaimer, we can discuss later, as a, across countries in the region. And, the graph uses different color coding where available to differentiate between coverage delivered through social insurance or contributory systems. This is the light blue. Coverage delivered through general disability specific benefits. This is the very dark blue. And coverage provided through general social assistance, meaning through other types of safety nets, which are not specifically designed to cover persons with disability, but may end up covering them. This is kind of the middle blue. And we don't have data for all countries, especially on this last category, but you can see how kind of these different forms of coverage where data exists add up to making sort of the total coverage. And we can derive from this sort of few systemic issues which really prevent participation of persons with disabilities in social protection system. One is low labor force participation and informality that translate into limited protection from contributory schemes. And we know here that, for example, mechanisms to offer incentives to public and private sector employers to hire people with disabilities, for example, employment quotas, have generally not been very successful in most countries in the region, therefore reinforcing the lack of access to social insurance. Countries that have achieved higher levels of coverage have done so primarily through non-contributory benefits. However, most countries in the region lack comprehensive tax-funded dedicated disability benefits. They exist only in some countries, and when they exist, they are relatively low coverage, quite fragmented. Also, awareness regarding entitlements tend to be limited, particularly amongst the most marginalized groups, and the administrative processes for identification are at times cumbersome, often, as some have mentioned, with a bias towards physical disabilities. Where disability identification system exists, for example, disability cards that exist in several countries, they tend to be associated more with tax exemptions and access to other in-kind services, as opposed to direct income support. So as a result of this, coverage in social protection is primarily delivered through targeted social assistance safety nets. And I'll speak a bit to that in the next slide. Of course, this relatively low coverage is a reflection on relatively low spending gap too. So most countries in the region allocate less than 1.5% of their GDP to non-contributory social protection scheme. Much more goes to the contributory schemes for employment-related benefits. And only a fraction of this 1.5% is actually spent on disability-specific cash benefits. COVID-19 has seen a relatively great expansion of protection, but for a relatively limited period of time, and we see concerns with limited with the sustainability of the impact of COVID in terms of sustained coverage expansion and also sustained spending. I want to mention also here the intersectionality between gender and disability. Some of you have spoke to that. So really the barriers that prevent persons living with disability in accessing social protection are particularly, if you want, entrenched for women living with disability because of their more limited access to labor market opportunities. And also there is a dimension of limited recognition of the care burden that often falls on women in terms of also the social protection dimensions of it. So for example, women with caring responsibility are not recognized in terms of their social security rights to pension or participation in social insurance in most countries in the region. So the gender dimension is both for persons living with disability and also for those caring for persons living with disability. Now, just one slide on this coverage through generic safety nets. Is it enough? So we see that across the region, in countries such as Egypt, Jordan, and go back here, if you look at Palestine, an important portion of what we can call coverage in social protection comes through generic safety nets. The problem with this is that general social assistance systems are rarely designed with the explicit objective of including persons living with disabilities. They do not sufficiently address exclusion errors and barriers to inclusion amongst persons with disabilities. They do not provide adequate additional benefits to compensate for disability-specific costs or referrals to other essential services, and often create a disincentive to take up employment. They also most of the time weak, a strong regulatory or legal framework. And finally, they have seldom seen substantive engagement of disability persons organizations in the design and implementation of such schemes. So here I report some figures from Palestine showing really the extent of the exclusion errors of those safety nets which cover persons with disabilities, but cover them on the basis of poverty targeting and proxy means testing. You see in the table at the bottom that a bit more than a third of persons with disabilities are excluded by design through successive PMTs that have been implemented in Palestine, meaning that the scheme by design misses even on the poor amongst persons with disabilities, let alone the notion that right to social protection for persons with disabilities should be delinked with poverty. And second, the graph also, the chart tells you how dynamic poverty is, and so how much these safety nets are constantly chasing a changing landscape in poverty, where within the space of 5 years, about half of those who were extremely poor are not extremely poor anymore. And therefore, this constant recertification of social safety nets really ends up missing an important part of those who are in need. To reflect, many countries in the region are actually very much tinkering or struggling with this issue. And we see, for example, in Jordan or in Palestine, how additional windows have been created to include persons with disabilities, even when they don't meet the strict PMT eligibility criteria. And also where in some other context, for example, in Jordan, there is now a big debate as to whether persons with disabilities who are no longer eligible after a new PMT recertification should be dropped from the programs or kept on the program. Really exposing the tension between a social protection system that focuses on poverty and one that really addresses life cycle vulnerability in an inclusive manner. So this, I think, is a defining factor for the discussion on inclusion of persons with disabilities in the region, is really how to move beyond this view of poverty social assistance towards life cycle social protection floors. And here I just end on some examples which maybe can give us some hope or some breakthroughs at regional and country level. You are probably aware of the Ministerial Declaration on the Future of Social Protection in the Arab region. It was signed by ministers in November 2021, and it takes a commitment towards life cycle social protection floors, towards extending protection to persons with disabilities, protecting workers in all forms of employment, linking social protection with services, and also ensuring benefits are adequate for dignified life. This is, of course, ink on paper, but it is a commitment that perhaps we will have a responsibility to follow up on. To come to some more concrete developments, I invite you to follow closely the developments in Oman, where a new social protection law will soon be approved to introduce a universal disability benefit together with a universal child benefit and old age pension in the context of the comprehensive overhaul and redesign of the whole social protection system, really embedding this notion of universal access to social protection at the core of the social contract in Oman. And finally, I would like to close on the National Disability Allowance. Farah spoke about it, and I would like to perhaps invite all of us to see some elements of positive progress in what the National Disability Allowance represents in Lebanon, despite the challenges. And I want to, this was recently launched. It's a scheme that has a focus on youth between 18 and 28 years of age. I want to highlight, Mar, you want to stop me now?
Yes.
Okay, good. So
I thought you wrapped up. Thank you very much.
So I will just mention 3 points about this program, which I think are worthwhile highlighting and perhaps positively looking in terms of the novelty of the approach. The first one is that this is not a poverty targeted program. So Farah, this is not a program that has any form of PMT based or rationing based on poverty. It's actually designed on a notion of a progressive realization of universality, with a view at being universal for all persons with disability in Lebanon, while giving priority during the initial phase to youth aged between 18 and 21, given the elevated risks of social and economic inclusion that they face as they transition from leaving their homes or institutions to accessing education. So it really shows how adopting a simpler targeting makes for inclusive and trusted programs towards establishing national social protection floors. So it's very much seen for us who have been engaged on it as a foundation of a floor, and the development of a social contract with the vision of a state that provides for people through life cycle social protection. The second element I would like to highlight is really the effort that have been made to build this as sort of embedded in government structures. The NDA was designed as a national program embedded in MOSA, with an early view for government ownership, capacity strengthening, and sustainability. It is operated through the national, the MOSA Rights and Access Centers, and very much the question now and the big agenda on which all of us hopefully can join hands and advocacy is to get government to commit its own financing for the sustainability of the program. And the third one I want to highlight is the engagement of the OPDs, of the organizations of persons with disabilities throughout the process. I put here some of the statements of the positions, yes, of the positions that OPDs have taken regarding the matter of social protection in Lebanon and this program specifically. If there is time in the discussion, I can tell you a bit more about our experience of working with organizations of persons with disabilities in the journey in understanding the role of social protection for disability inclusion and specifically the NDA. So for now, let me leave it at this and back to you.
Thank you very much, Luca. Again, it's an apology to all of the speakers. This panel is fantastic and we really thank all of you. But time is what it is, so we're going to have to move to our final panelist, Rachel Forrester Jones. Professor Jones Research scans the life course of people with intellectual disabilities and people with mental health issues, with a primary focus of advancing the social inclusion of vulnerable adults. Her research has been conducted across Europe, UK, and Brazil, and more recently in the Middle East and North Africa. Professor Rachel Forrester-Jones is Director of the School of Health Studies at Western. Rachel, the floor is yours. Thank you.
Thank you very much, Mark. Can I just ask you how much time we have left? Because I don't know.
This is, yeah, well, we are technically the webinar will finish at 12, in 20 minutes, because we have different time schedules here. I will ask if we can actually extend it for those who want to stay for the Q&A for half an hour. I don't know if this is possible. Mohammed may get back on this to us, but go ahead, about 10 minutes, Rachel, 10, 12 minutes, and it's only fair. Thank you. There's a lot of information, and I think,
okay.
Yeah.
All right. Thank you so much. Thank you so much. And thank you for having me, everybody. And I'm so pleased to really hear all of those presentations. And I think that mine probably encapsulates a lot of what's been said. And I will try and review and summarize some of the major points from the previous papers. Next slide, please. I'd just like to acknowledge funding agencies who have contributed to the work that I'm currently pursuing with colleagues from the University of Bath, including Rana Jawad, and that's the Ford Foundation and the UK Arts and Humanities Research Council Global Challenges Research Fund. And some of what I'm going to talk about has been informed by focus groups and interviews with 12 NGOs and 8 family carers across MENA countries, particularly Lebanon, Jordan, and Tunisia. Next slide, please. So what I'm going to talk about very quickly is I just want to bring us back a little bit to maybe some of the more conceptual arguments and concepts that we need to grapple with, I think, in terms of moving forward with disability rights agendas. And that is what we mean by disability and social inclusion, the risks for persons with disability, the rights to social protection, and how rights may be activated as in terms of the actual title of this webinar. Next slide, please. So I use the term disability, and you can see that dis is in brackets there. And because disability encompasses abilities as well as difficulties a person may have navigating everyday life in society. So, for example, a person with disability may actually be able to think through and solve a problem of accessibility. So I think one of the issues that we have across the world, and including the MENA region, is that we think of disability in terms of the difficulties and not in terms of the positive contributions that people with disabilities can make to society. So disability, therefore, also denotes how society disables people through its physical, its economic, and its political ableist structures. In other words, most of the political structures, the political economy is ableist. In other words, it's really geared towards people without disabilities. So society, therefore, needs to change, not society changing the person. The second issue that I want to bring forth is the vicious circle of poverty, and all of the presentations so far have talked about this circle of poverty. So those who are poor are more likely to become more disabled, and those who are disabled are more likely to be at risk of poverty. And I think we need to really get to grips with this vicious circle. One of our participants in Lebanon said, alongside with a lot of catastrophic crises in Lebanon, financial, economic, social and political, the worst affected in that regards are persons with poverty and persons with disability. The third tenet of this conceptualization really is that, yes, there have been phenomenal strides and positive laws coming into place within the MENA region. And again, you know, these presentations have highlighted these. But still we find that policies are not implemented. And I'm not saying that this is unique to MENA. It's really a problem across the world. But when you have policies that are not implemented, they're not really worth the paper they're written on. What are the participants that we've been interviewing have been saying is that actually, even when they are implemented to a certain extent, the formal system, in other words, the formal system that provides cash transfers, the formal system that provides, that is targeting, is difficult to navigate for many families. And therefore, what families do is they resort to reliance on their family and their extended kin. The other issue that maybe hasn't really been brought to the fore is in terms of the way in which policies are not always implemented. So, for example, cultural practices and family practices within different societies across the MENA region will have different interpretations of the law. Now, as a qualified barrister, I'm interested in these interpretations, and I can understand that some of these interpretations will be different. But when you think about a person who has capacity, who has an intellectual disability, but can actually make decisions for themselves, would like to make decisions for themselves, but are not able to, or are not allowed to make decisions for themselves because of cultural nuances and families feeling that they must make decisions for their loved ones. So these are difficult issues to grapple with, but I think we have to have a conversation about those. The issue about resorting to reliance on family and extended kin is a very real one, and it was highlighted in COVID across the world. Again, not necessarily related to the MENA region, but where families are already having difficulties with poverty, having difficulties with informal work practices, a child or an adult child with a severe intellectual disability, for example, can be incredibly difficult for those families. It's also argued that this is what people are saying. This is not what I'm saying. This is what people that we've interviewed are saying, is that some of the NGOs and charitable organizations and the services that they provide are not actually appropriate. It's not the most appropriate care, and there are few government checks. There are few quality government checks. So that's something I think that also we need to think about. The other issue is that the civil movement of advocacy can often be fragmented. NGOs and charitable organizations that are trying their best, of course, to provide services can actually end up quarreling amongst themselves rather than working with themselves, between themselves, because of the lack of funding that's coming forth. International donors, I mean, we did have this amazing UNICEF program, which I think is a really phenomenal and very exciting. And I think hopefully other international donors will seek out and try and replicate that kind of program, because what people are saying in Tunisia, in Jordan and Lebanon, is that international donors very often want short-term results, and therefore they don't always want to work with organizations like MOSA. They don't always want to actually put in and help people and help advocacy and advocacy groups, self-advocacy groups move and change policy. And this is really what they should be doing. And one of the problems is that when international donors just give a grant, money that is short term, where does that leave those organizations once they have left? Next slide, please. And I want to talk about social inclusion. And social inclusion has received prominence in government policies across the globe, and which generally call for the furthering of individuals' social and economic participation, as well as their political and civil rights. And I think Farah was saying in the first presentation that people with disabilities should be educated to know that it is their right to have additional help to participate equally in society. It shouldn't be like a pity, a charity in that sense, of the kind of charity model. Now, a network of socially integrated, supported relationships in the community may be regarded as the apex of social inclusion. So when we're talking about social inclusion, we are talking about economic participation. Yes, we are talking about money for additional physical technology that is needed, and physical and cognitive behavior therapy and so on and so forth. But we also are talking about social inclusion and social networks. A social network is an opportunity framework of relationships which may or may not provide a person with various types of social support. If we have a social network of relationships, then all the research shows that those are associated with very positive outcomes for our life cycle, such as happiness, self-esteem and confidence, mental well-being, leisure activities, love. They may also be abusive. But in a sense, I think this is a really important aspect when we're thinking about participation of people with disabilities, because social networks also enable us to have social capital. Social capital is the potential of individuals to acquire benefits and find solutions to their everyday problems through membership of social support networks, including formal networks, for example, state actors providing cash transfers or services in kind, semi-formal networks, for example, NGOs providing information, transport, daycare provision for children, additional cash gifts, and informal network members, family and friends providing, for example, food and psychological support. My own work, dating back from 1997, on people with mental health problems and people with intellectual disabilities, has shown that whilst positive social support can act as a buffer against physical and mental ill health, people with these types of disabilities are less likely to be part of a wider social support network. Their average size of a network, the average size of a network for ordinary populations without disabilities is about 90 to 150 network members, not including Facebook. But people with intellectual disabilities have an average network of just 23 network members, and people with mental health problems, an average network of 22. So individuals with disability, their social networks are impoverished, and that can lead to this vicious cycle in more ways than one, because poor social capital refers to a lack of such social networks, as well as digital technology, including poverty of social media and Wi-Fi. Where those social networks do not exist, then often religious movements or charitable institutions will fill the vacuum. That may be positive, but it's not always resulting in the best interests and the best outcomes for beneficiaries. Next slide, please.
Rachel, if you could wrap up, that would be great. Thank you.
Yeah. So this slide just encapsulates a number of treaties, declarations, and conventions that I'm sure you'll all know about. And one of the things that I would just say about this is that these are international covenants and treaties that most of the MENA countries, now I know Lebanon just signed up to recently to the UN to the UN Convention for the Rights of People with Disabilities just earlier this year in March 2023. This is all fantastic, but it's in terms of the implementation of those treaties. Next slide, please. So how to activate rights of persons with disability then? There are crucial elements, and I think that these really encapsulate what the other presentations have said. We lack data on disability. If we do not know how many people have a disability, how can we absolutely strategize and provide what those individuals need? How can we meet their needs if we don't even know how many people there are? So that's something that absolutely needs to be rectified. We need to adopt a social model of disability. In some of the presentations, I noticed that the medical model of disability, the classifications of disability are still are still referring to the medical model. So we need to think about the social model of disability. Donors need to work with governmental agencies to develop sustainable plans to support persons with disability, not just short-term plans. And I would just give an example of the UK Care Act in 2014. That set out to measure and to provide services to prevent the care needs becoming more serious, so prevention. It also supports carers. But the one thing that was really good about that Care Act was it was developed from substantial public consultation. And I think, again, that is missing from all of this kind of dialogue, from all of the policy making. Where is the public consultation? We have to include people with disabilities. We have to include their families. We have to include civil societies so that we're not just imposing strategies, of policies that are just, quite frankly, risking not working sufficiently. Thank you very much, Mar. Would you like me to say anything else?
Thank you, Rachel. This is fantastic. Well, we have a decision to make. We have 6 minutes to go from the official schedule, and unfortunately, let me put my video on back. And unfortunately, I know that our colleague Hala has to leave for another webinar, which leaves us now 6 minutes for the Q&A part of this. Speaking of consultation, right? We have not been very good at keeping that time. It's also very short, 1 hour and a half, to be honest with you. So I would say let's move to the Q&A and let's see how we can continue the conversation. Thank you. Mohammed, over to you for the Q&A.
Thank you, Mar, and thank you for all the panelists for that great amount of information, excellent information, and it triggered the interest and the thinking of some of our participants, and thank you for that. So I would invite all panelists first to put their videos on, and I will start by reading the questions aloud for you to answer. The first one would be, are the needs of persons with disability mainstreamed in the social protection policies and programs at national and decentralized level? And that is not directed to any specific person or a member of the panel. So any answer to that would be welcome.
Luca, can I suggest that you may take these questions since you've provided a regional overview, if I may?
Yes, can you hear me now?
Yes.
Yeah, I mean, I saw 2 questions addressed to me. There was also one from Amal, and both of them I think perhaps could be addressed together. I mean, first of all,
then Luca, let me then put that question out there. So the second question that Luca mentions is, can Luca share with the participants or us his assessment regarding the status of skilled manpower needed to deliver the specialized services for persons with disability in MENA? Go ahead.
Yes, thanks. So I think this is an interesting 2 questions that sort of touch on the kind of policy versus service and the national versus decentralized sort of dimension of disability inclusive social protection. So to mention that several countries in the region are indeed developing or in the process of developing national social protection strategies as well as disability inclusion strategy. And I think increasingly, if you look at Jordan, if you look at Lebanon, a case I know well, there is an explicit recognition of course, social protection as a critical dimension of social protection system, as well as the disability inclusion agenda. The extent to which this translates into capacity to deliver, especially services at the decentralized level, I think varies greatly across countries, and is really where I think that the concept of proximity becomes critical. I think many of these policies have been developed at a national level. The capacity of governments to provide services which are decentralized and accessible, not necessarily only specialized services, but even proximity services. I mean, Rachel was talking about networks, about access to social capital that requires engagement in a day-to-day interaction, and that's really where I think governments in the region face a great deficit in terms of the presence of national institutions on the ground in a decentralized fashion. Again, it varies across countries. I think I can speak, for example, to the case of Lebanon, where the only services of proximity, which are called the social development centers, are really very stretched in their capacity to deliver, because so much is built on those only existing points of contact with citizens, from employment activation to running proximity test data collection to payment monitoring, and add on top the needed sort of support and also the needed capacity to engage. in a sensitive way on topics of disability inclusion. So I mean, I will leave it at that, but I know many others in the panel may have to add on these questions. You are muted.
You are muted, Mohammed.
Farah, please go ahead if you have anything to say.
Yeah, I was just trying to tell you that you were muted, but
Oh,
I'm happy
okay,
to
yeah.
come in. I'm happy to come in actually right after Luca's because I would like to interact with Luca on of course, not to argue that it is not a speaking about the National Disability Allowance in Lebanon. My bad, Luca. I didn't know it wasn't poverty targeted. I didn't know it wasn't for just the poor youth who have a disability. And at the same time, I might have also mixed speaking about the typical way of providing protection to people with disabilities being social assistance and poverty targeting. So knowing now that it is basically a progressive realization to universality, as you put it, is music to my ears. But here I would like to hear more from you, Luca, about how are you able to make this possible? I mean, given that we do not have a universal social registry, what is the delivery mechanism that you are doing? And at the same time, if you can, so basically, this is on the positive side, and indeed we do need to see some opportunity here. Now, despite the fact that it is not targeted, I still think it is for sure inadequate. A $40 transfer per month amid the current cost of living and what's happening, and knowing the extra cost that people with disabilities incur. And it does indeed allow them to fulfill their immediate needs, but will it be enough or sufficient? I doubt. It is not sustainable. I don't know how you are planning, or how, I mean, the implementing organizations are planning to carry this on after the funding is done. And I mean, interested to know more from you. I know you mentioned that it is now just for the youth, but at some point it will have to expand to other groups. Definitely, it will have to include, I mean, people, older persons with disabilities, and these are very prone. I mean, they're very susceptible to all socioeconomic shocks, and are in dire need for that. But also refugees. I mean, refugees with disabilities, not only the Lebanese. And I mean, speaking about sustainability, so here we will need funding to carry this on, and at the same time to expand to those very needy social groups. And here my question to you is, why did the government then, since they have the political will to do that, then why did the government did not do disability pensions for years, support for families or for people with disabilities themselves, and knowing the people with disabilities need for care at home? We've never seen in Lebanon support to provide this care for people with disabilities, home medical services, mobility grants. So why is it now? Here comes my comment, which is that I see the goodwill, I mean, of the EU. And by the way, I'm not sure I mentioned that, but I do salute ILO and UNICEF for what they are doing, because we do need these organizations to be able to trespass a corrupt government, to be able to implement such very important programs to help our people amidst what's happening, and knowing that the government otherwise wouldn't do anything. We do need that. And yeah, but at the same time, this is making the government look good. It's making the government, it's stabilizing the system. It's making the government last longer in power. It is causing social inertia because it's giving band-aid to the people. And it's helping the state evade its responsibility. So this is why I said, here comes my comment, because for long, the government didn't do through its National Social Security Fund. The whole disability component has been just like frozen. So why is it now that they are collaborative on or cooperative on that part? It is because of the funding coming from abroad, and for the political economic reasons that I'm trying to mention. But I mean, it is a dilemma that we do need these programs, and we do need the trans-state actors and the mediator role that they are playing, and probably the positive conditionality they are trying to exert. But at the same time, it is making the government forget that it is its responsibility to provide this social protection to the people. And here my last comment on this note is basically, I mean, we do need you to exert more of this positive conditionality. We do need you to help the government take all of these, I mean, all of this data to build building blocks to use those as building blocks to building universal social registry that were otherwise never be possible in Lebanon. Also speaking about the consultation with CSOs, I'm so happy that this process has become more participatory in terms of social assistance programs, but is it the knowledge producing civil society that is being consulted, or just like the implementing civil society? This is something to raise. And finally, now knowing that it is not targeted, is it like, can we think now that the reason why the NPTP and the SSN have expanded since 2021, but until now they only cover 15% of the Lebanese population? Is this, for example, the reason behind that? Is it because it was targeted? So is it, if we remove the targeting component from social assistance, will it like solve the problem? I know this is so many questions, but I do mean I do mean to solicit answers. So this is why I post, maybe you will not be able to cover all of this, but it is important to listen more from you, Luca, and whoever feels comfortable also about this. I do need genuinely the answers, not that I'm trying to enumerate tons of questions. Thank you.
Just before then, Luca, I'm very sorry, and Farah, I'm very sorry. I think I'll give you 1.5 minutes to answer, but pick up the conversation later, because Farah, you left us with very strong and very good questions. So Luca, 1.5 minutes before I will need to close the session.
Yeah, I mean, what I can say is that, yeah, we need to have a good coffee with me and with the rest of the team, but also honestly with so many others who have been working at it, because you raise very fundamental points, Farah, about, you know, the role of the international community and what is progressive realization, where to start, what hinders the realization of that vision of social protection floor. Is it to build it all at once, or do we want to build it gradually? And then the issue of sustainability. What is sustainability? Political sustainability, institutional sustainability, financial sustainability. We are working at all those, we're thinking about all those dimensions, and are quite serious about, you know, not seeing this as kind of a one-off temporary band-aid, but those matters fit in a broader political economic context. But if you allow me, I just want to go to one specific point you've mentioned, which is an element of sustainability is, in my opinion, and as we're talking about the topic, the participation and the engagement of organizations of persons with disabilities in the process. And here I want to mention that the team have approached the OPDs over years on this project. And after many years of discussion and interaction, the perception of the OPDs has changed on the social grant and shifted away from what was perceived as, let's say, from the initial resistance as something which was perceived as charity rather than a right, or a substitute for the inclusion of persons with disabilities into the labor market, to actually a matter of dignity, of inclusion. And especially one point that in a recent statement, 8 organizations of persons with disabilities have highlighted is the fact that the NDA as an individual benefit brings up a step closer, I'm reading, a step closer toward transitioning away from the institutional care and towards effective inclusion of persons with disabilities in societies as mandated by the CRPD. We are working with OPDs to engage them not only in the design, but also in the implementation phase, and that's critical. And that's, again, an element of sustainability, how to ensure that the demand for this type of approaches and the design of the approaches and the implementation of these approaches is driven by persons with disabilities, voices and organizations, as opposed to, let's say, only kind of a top-down agenda, which may be driven by benevolent agenda of the international community or political agendas of the political elite. So it's very much about giving voice to the OPDs, and the process we've built, tried to make it as explicit as possible as part of the strategy, and for the rest, over coffee. with my colleagues as well, Zania, Rania, Zaina, and the rest of the team, and UNICEF, and the EU and the ministry. Over.
Thank you, Luca, for your prompt answer to that to this. Unfortunately, I will need to wrap up the Q&A session, although we had other contributions from the attendees. So apologies for that, but thank you. We'll try and answer these in another medium. I will want to pass now the mic to Mar for any last words before concluding our webinar today. Thank you.
Thank you, Mohammed. And I just want to thank every single one of the panelists for really wonderful conversation, which I know was very short. But as I said, I think there's a lot of food for thinking. And I think the length of and the depth of the conversations and the conceptual issues that have been raised really speak to the need to continue this conversation. And this is an open invitation to all of us here and those who are listening to this webinar to come together. We will try to structure this in the future and keep having these webinars in a more regular manner. So, and I, again, as I started with a disclaimer, we have to have organizations of persons with disabilities actively participating, not just in the design of process, but also in the dialogue that comes along with it constantly. So thank you all very much. And I invite everyone to get in touch with us on the ISSPF website, ARDD website, website, ILO. There's a lot of UNICEF. There's a lot of information that is out there for our knowledge, and more to come. So thank you all. Thank you all very much. Bye-bye. Thank you, Mohammed.
Thank you all.
Goodbye.
Bye-bye.